Everyone got their white balance and everything? All right. Well, thank you all very much for coming. I'd like to start by just introducing the Mayor of Dallas, the 60th Mayor of Dallas, Eric Johnson.
Thank you very much, Tristan, and thanks to all of you for being here today. I want to keep my remarks relatively brief before I turn this over to Dr. Kelvin Baggett, who is our city's new COVID-19 Health and Healthcare Access Czar, and to John Jenkins, our city's Park and Recreation Director. Mr. Jenkins is going to talk about the next phase of our park reopening plans, and Dr. Baggett is here to provide you all with an update on what he's been working on as our city's COVID-19 Health and Healthcare Access Czar. But first, I want to take just a few minutes to touch on a few issues related to our recovery and our assistance efforts. As you may have seen yesterday, I announced that in collaboration with Borden Dairy and the Dallas Independent School District, we are launching the Mayor's Milk Initiative. This initiative is funded through a United States Department of Agriculture program, and we will use it to distribute thousands of gallons of milk for free to people who are in need in the city of Dallas. As you might imagine, we have a great deal of need in our city right now. This will help, and we're going to continue to look for ways to help people through this pandemic. Secondly, I want to reiterate something that we announced earlier this week, and that is that our mobile testing program is now going to be available to all zip codes in the city of Dallas. We're going to continue to give priority to zip codes that have been especially hard hit by COVID-19, but we believe that we have the capacity to handle the demand for mobile testing, so we are going to be expanding that program to all zip codes in the city. As a reminder, this testing service is free, but it is currently available only if you lack transportation to one of our drive-through testing sites, if you present symptoms, or if you have had recent direct contact with someone who's been diagnosed with COVID-19. To schedule an appointment, you can call 1-888-601-0568. Again, that number is 1-888-601-0568. Next, I want to talk a little about something I'm excited about coming up next week. Although, as I expressed yesterday, I am disappointed by some members of the City Council's decision to skip a committee briefing on the subject, preventing the committee from hearing the matter as scheduled and wasting valuable time and city resources in the middle of a pandemic, I'm still committed to moving forward with a Dallas First resolution. This policy, if passed by the City Council, will reward contractors that are based in the city of Dallas and that hire locally in a time when we all need to do everything we can to stimulate economic activity in Dallas. After health and safety, our economic recovery remains my top priority for the city of Dallas and its people. And finally, as you know, we're now in phase 2 of the governor's reopening plan. I realize that there is intense interest in how this is going to go because we haven't yet seen a decrease in the number of positive cases here in Dallas County, although we do appear to have plateaued for the time being. As I've said numerous times, the governor has the ultimate authority in a public health emergency under state law. So I'm not going to waste time or energy Monday morning quarterbacking what the governor's already decided. But I am going to caution our residents again that reopening does not mean a return to normal. This is not over. We are still in the middle of a pandemic. We are identifying hundreds of new cases every single day in this region. People are still dying. I said this frequently before Dallas went into its stay-at-home orders, and I can't say this enough now. Wear a mask when you're out in public. This shouldn't be a partisan political issue. It's just common sense, responsible behavior. You should also practice social distancing. Wash your hands thoroughly, avoid touching your face. Don't be part of large crowds. We shouldn't be having large parties in our parks right now. This virus is still present and it's still spreading in our community. I know we're all tired and we want to return to some semblance of normal. We all want this economy moving again, but we have to do it responsibly or we risk further interruptions and possibly more loss of life. We've come so far and we've worked so hard to slow the spread of COVID-19 here in our city. Don't give up now. The vast majority of you, I know, are being responsible, but we need everyone to look out for one another. Now, I want to introduce to you all Dr. Baggett. He is a seasoned healthcare executive and physician who is currently the senior advisor to Pharaoh's Capital Group and the managing director at Posterity Capital. He was previously an executive with Tenet Healthcare and HCA. He completed his medical training at Yale and had advanced training at Johns Hopkins and Duke University Medical Center. He has a BS from the University of North Carolina, an MD from East Carolina University, a Master of Public Health from Johns Hopkins University, and a Master's of Business Administration from Duke University. And I'm proud to say he is also a resident of the great city of Dallas. I am absolutely thrilled to have someone with Dr. Baggett's credentials and experience helping with our city's COVID-19 response efforts. Like all of my task force members and czars since I became mayor, Dr. Baggett is volunteering his time and resources and working for the good of our great city. And for that, he has my sincerest appreciation. I'll now turn it over to Dr. Baggett.
Thank you, Mr. Mayor. Good afternoon, everyone. What I would like to do today is to share with you some of the things that I've done since I was appointed to this position about 8 days ago. And so I have a few slides that I'll be walking through just to give you some insights that I've gained during this process in collaboration with a lot of people, some names that are less familiar, in every effort to promote the health and safety and security of the citizens of Dallas. I want to echo, before I start this, the mayor's remarks regarding the things that we need to be mindful of, vigilant around, to continue to promote and protect the health and safety of all. This does require a community effort to make sure all of us are safe and that we minimize the loss of lives and the impact to so many who are dependent on us and who are vulnerable. So let me start. First, I'll lay out a little bit of the framework that I've worked from, that the mayor and I discussed prior to and subsequent to me taking this role, to put some things in context, to make sure that we were utilizing the resources that are available to us, and also thinking very judiciously and thoughtfully about how we would proceed. I'll also talk a little bit about how I've approached it, some of the insights that I've gained from conversations and information gathering, as well as the next steps that we will be undertaking. So we framed this in the context of what do we do to better detect the virus within our community and understand just how deeply and broadly it is impacted, as well as looking at measures that we could take to prevent the spread and to prevent harm from those who actually may be most susceptible and most vulnerable. Also, how do we promote health at a time when obviously that is in focus and we can see the implications and consequences and how broadly they are, and not just for COVID, but for the broader health, physical, mental, emotional, for our entire community. So here's a list of some of the individuals with whom I've had very frequent and informed conversations. What this is a representative group of leaders across the Dallas community, some of whom are charged with this as part of their own responsibility, others who, as Mayor Johnson said, like myself, have taken it on voluntarily because we have been so blessed and fortunate to actually be Dallas residents and want to do everything that we can to contribute to the successful emergence and handling of this as a city. I think everybody is familiar with Dr. Wong and the work that he is doing in his leadership, and I appreciate the relationship that he and I formed in very short order so that we could actually think about some of the ways that we might better work together so that we could help to accelerate and advance things. I've also worked very closely with the task force, the other task force that the mayor created on economic recovery, and I'm pleased to say that there we have a real partnership. That is one of the things that I am very pleased of. We have handled it well in terms of the relationship between the business and the health community and how we think about Dallas and the entire health of our community. You can see a list of others, and what I'd also like to say is you will notice that there are certain people that are unnamed but fall into categories, and those are individuals that I've engaged and who've reached out to me, healthcare leaders across the community. I've also reached out to people across the country in some of these capacities to learn what some of the best approaches and practices are and to begin to incorporate them into our thinking. And I'd like to also remark that we are expanding our outreach to other community leaders, including those within the faith community as well. We see them as vital to this effort, and as I've reached out to them and had contact from others, what I can say is they also want to be engaged, of course. They want to be supportive. They want to be involved in ways that actually help us to continue to do better. So what has been doing well? Because there's a lot of discussion and there's some interpretation of what's going on around the nation and then how that lens gets applied to things that are going on in Dallas. I think one of the things that the mayor has done really well is leverage his resources and contacts to actually bring testing into the city of Dallas. He just mentioned the ways that we've gotten creative in terms of how that testing gets deployed for those who may have had more limited access to some of the testing that's currently offered. So I would say that Dallas has done that incredibly well. The other piece is that there is the recognition amongst many, if not all, that there are those amongst us who are incredibly vulnerable and therefore more at risk for this virus and what some of the consequences may be. We have made every effort to identify those individuals with pre-existing conditions, individuals who actually may also be less mobile, may have other social factors that may influence their risk, and not only to recognize it, but to mobilize efforts to actually address it. And so we're doing that well, and we will continue to do that. Also, promoting health access. The mayor just mentioned one of the initiatives that he's actually been able to also bring to Dallas in terms of being able to provide milk and some of these other services, the essential services that are necessary. And so we're doing that to people who are in need and that we've also asked to stay in place and also maybe dealing with some of these other associated consequences related to the virus. In my many years of working in healthcare and serving in senior and executive management positions in two of the organizations that Mayor Johnson mentioned, both who have a local presence here, I can tell you that I have not seen the degree of collaboration and coordination between those who would be deemed more natural competitors in terms of sharing best practices, thinking about the resources, how they're actually working on prevention, sharing data. And so I want to commend the city and the healthcare resources and leaders around the community who've come together and seen this as an opportunity to work more collaboratively together and to work in partnership. We've also seen the heightened awareness and implementation of safety measures to protect everyone who's coming into these healthcare facilities and to make sure that they're safe as well. What can we do better? So we are having conversations, and not only that, digging deep to determine how we more broadly expand the testing and the testing capability. It is not just about more tests, but it is about where do you deploy those tests, what are you doing with the information that you're receiving from those tests, so that it then empowers you to inform decision-making and to make sure that people are seeking care where necessary, and that we're identifying other potential areas where the virus may be more present so that we can actually then direct actions. In terms of prevention, we are being led and informed by the data, and we continue to need data gaps that need to be closed, and we're addressing those. Accelerating what we're doing in terms of contact tracing. At this point, we should have a higher percentage of cases that are being identified by the tracing, and we're working to find ways and also to offer suggestions as to how that could improve. Piloting approaches. We understand that we're a very diverse community and that there are approaches that may work in some areas in terms of how we engage, how we communicate, how we educate and gain awareness that may be different in others. So we're also working with other community leaders and organizations to not only understand that, but to mobilize that action as well. In terms of health promotion, we're increasing awareness around the need and recognition of seeking care, not just for COVID-19 related, but also pre-existing conditions that may have gone ignored, as well as new symptoms that may be surfacing. We want to make sure that some of the data that we're seeing nationally that we're thinking about and responding to, and what we are seeing at times is people underutilizing emergency medical services, not going in when they're actually experiencing chest pain and some other symptoms. And we want to make sure that people also know and feel safe going in so those things can be addressed. We are having a data-guided discussion around disparities and where and if we are seeing that and how we respond to that differently. So the next steps. We know that there are so many community leaders who we could engage, who want to become involved, and again, have a different voice, have trusting relationships, and may understand some of the nuances in terms of increasing education, awareness, symptom recognition, and also reporting for testing and some other treatments. And so we're engaged around that, the faith community and other leaders, and we'll continue to move that forward. Also, how do we thoughtfully, carefully plan and implement testing and place it? And so working through that to make sure we have it in places, talk about mobile capacity, and also other testing options. We are moving to better leverage our contact tracing. The data that we're getting out of that currently is not meeting our expectations, and we're moving to better understand who is being identified, again, without exposing protected health information, but who's been identified, have they been contacted, and what measures might have been undertaken to address any symptoms that they also might have been having. We're continuing to partner with business leaders, especially as we go into this phase of reopening and have more activity around that. And I will say lastly, I don't want to understate the importance of doing everything we can so that our citizens do not neglect prior or presenting symptoms related to their health. What we want to make sure we're doing is continuing to address that and promote their presentation in environments so that those can be addressed. I've had calls and conversations and participating in them with groups of healthcare leaders and others who are telling me about incidences where people are presenting to the emergency department and otherwise with things that might have been prevented or addressed earlier with less consequence. And we want to make sure that we're doing everything to inform and to actually also provide an opportunity for those individuals to come. So with that, Mayor, I thank you for the opportunity to speak to the work that I've been doing over the last 8 days and to be a part of this effort.
All right. Thank you very much, Dr. Baggett. That's a week's worth of volunteer work, ladies and gentlemen. We're going to turn this over to John Jenkins, the Park and Recreation Director.
All right, thank you. As the response to the COVID-19 emergency continues, please know that we are taking all necessary steps to ensure the public's and employee safety while implementing phased reopening plan for our park system. As a continuation of our next steps, the following facilities and events will be open and available beginning Friday, May the 22nd. Our dog parks will reopen. We have installed foot pedal opening gates to reduce touch points. Our skate park will reopen, disc golf, park pavilion reservations, but they will be limited to a maximum of 15 people. Small outdoor events, once again, limited to 15 people. Rowing clubs will resume, limited to one person per boat. We believe we have a good plan for our phased reopenings, and we'll routinely evaluate these operations and our procedures to ensure we are protecting our customers and employees to the greatest extent possible. Mayor?
All right, we'll open it up for questions now.
Just talking about mobile testing, it seems like maybe not as many people were aware of the capability for that since it was implemented. Talk about decisions to open it up to more zip codes and what's being done to make sure that people are aware of that opportunity.
Sure, the question is, because I'm not sure if you're mic'd or not. Question is what the decision to open up mobile testing to all zip codes, and did I miss what was the second part of that?
Just what's being done to make sure that everyone is aware.
What's being done to make sure everyone is aware? Well, I mean, today is a step. Obviously, we hope that you'll get the message out to make everyone aware. The number, once again, for people who need to be screened is 1-888-601-0568. I think it's important that we continue pushing that message out. We've been sharing it on social media. I know there were some robocalls or some, I forget whether they were robocalls or just regular calls, but there were phone calls being made to people in targeted zip codes, the originally targeted zip codes. But it was more of an assessment of just we had the capacity to handle more, and we wanted to make it available to everyone in the city. I don't know if anyone else.
I want to speak to that before we move on to another question, because I think that Dr. Baggett has a good perspective, an interesting and useful perspective for you to hear on this. We had a conversation a few days ago about testing and the difference between testing capacity and testing consumption, and how we've done a good job of talking about the need to increase testing capacity, but we haven't had as much of a robust conversation around increasing testing consumption. And so that is what I think your question is kind of getting to. The reason we were able to expand it to more zip codes, and that decision was a decision that could be made, it was a decision that would be considered a sound one, is because, and I've seen this in my conversations with some mayors from around the country, the mayor of Los Angeles comes to mind, Mayor Garcetti and I had the same conversation when he was able to use some of his CARES Act funding to increase testing capacity in Los Angeles. They didn't see the percentage of their capacity that they had being utilized to the extent that they liked. So it's a two-pronged challenge. You want to build the capacity, but you also want to have people take advantage of it. So I'd love to hear Dr. Baggett share those thoughts with you, but that's something that we're keenly aware of. We need to do a better job of making people understand what resources are available now. Because it started off as a deal where, you had to be symptomatic and you had to be a certain age, or you had to have a certain, line of work that you were in. And now we're to the point where we can actually accommodate more people than we could before, and we need more people to actually show up and get tested. So I'll throw it to Dr. Baggett to explain that a little bit more, but I think it's a great question.
Yeah, thank you, Mr. Mayor. So when we talked about it, we set a threshold of at least 90 to 95% of the testing being consumed, and to do everything that we could to actually promote that through community engagement, awareness, and also placing it in certain areas and addressing the criteria that's associated with it as well. So this is part of that effort to expand it, recognizing that we did have more, and also it provides us additional information regarding where COVID-19 might exist within our community. So moving beyond those who are sick and were at the top of the list for very good reason in terms of being presenting and being tested, but also beginning to get an understanding and appreciation for just how broadly this may be and other efforts that we may undertake to address it. And now we're at a phase 2, to go back, that we have not only the testing, but also information that will be coming forward from contact tracing. And when you combine those things, that gives you greater visibility into where it may be and then the interventions that you may undertake to address it.
Yes. Oh, him first, and then we'll come to you. I'm sorry.
Do you have an update on the hospital capacity? Last week you mentioned it was maybe up to 80%, and what percentage of that ICU units is being used for COVID-19 cases?
Okay, so we've never gotten up to 80% capacity in our beds, general beds, ICU beds, or ventilators. If I recall our latest numbers, and again, these change daily. There's not been wild swings from one day to the next, but I think we're at about 71%, which is the highest we've been for any single day on ICU bed capacity, and maybe 65% or so, mid-60s range on general hospital bed capacity. And the percentages I'm giving you are the percentages that are filled, so percentage that are occupied. And then the ventilators are somewhere usually in the 30% range. I'm not sure exactly where, but so the number there that's the highest that we've seen so far would be the ICU bed number. I wouldn't read too much into it yet. It's one day, so it's something we're going to keep our eye on. It's something that I pay attention to and look at every single day. I've ordered that reporting from the earliest days of my orders related to public health. That was one of them, because I wanted to make sure if we ever got to a point where we should be concerned, because we saw a trend where it was just ticking up day after day, that we could do a few things. One, after a conversation I had with the governor a week or so ago, he assured me that if we ever got into the danger zone, consistently above that 70% number and started to creep up, that he would step in very swiftly to assist us with increasing ventilators, getting ventilators here on a moment's notice, and helping us address our capacity issues. We still have the ability to go to the K. Bailey Hutchison Convention Center and stand that up to help expand capacity relatively quickly if we need to. Obviously, that's something we'd have to, to work on with our partners and try to get federal government help, hopefully, if we had to do that with staffing it and work with other partners to staff it, but it is physically there and available. So not something I would say to worry about or panic about at this point, but something that we should keep our eye on, and it is at about 71% on the ICU beds, which is the highest one-day percentage usage we've seen since we've been tracking it.
Yes.
Yeah, I have a question on something that Dr. Baggett did weigh in on, because there's been a lot of talk about flattening the curve, but also a lot of debate over what data points are most reflective of what's happening with the virus. What data do you think is most important to track?
Thank you. So we're obviously, with flattening the curve, a lot of that was about making sure that we did not exceed the capacity to treat and to provide care. So the metrics that Mayor Johnson just provided in terms of his commentary around hospital utilization is incredibly important. We're also looking at the number of new cases and obviously tracking that and making sure that we're understanding where that's going and where that's coming from. So new sources, maybe different populations, different conditions, and understanding that. So that's where we're digging into the case data. And the other piece, as I mentioned, is around the contact tracing. So those are the data pieces. To stay flat, we want to make sure we have the capacity to treat. We want to understand how many cases are coming up every day and what that's telling us about our trend lines, what the outcomes that are associated with those cases as well. And those are the things that we're monitoring to make sure that we're making progress or to redirect some of our energies or our efforts to address.
All right, any other questions? All right. Yes. We'll make this the last one, so.
Could you explain what the workflow is between what the doctor is doing whenever he comes up with a recommendation and how that becomes maybe a reality, put it that way?
The question is about basically the next steps, like what his job,
Yeah, he's talking to all these different sectors of the community something to be implemented?
The short answer is that depends, but I'll turn that over to the mayor.
I will let Dr. Baggett also address this, but my intention in asking Dr. Baggett to serve as a czar, and that term is just capturing the fact that he is supposed to do a lot of different things that can't be captured in a title very easily. It's a catch-all title, but the main thing is coordination. And what I need him to do, and what we've talked about at length, is making sure that from the city of Dallas's perspective, that we are doing everything we can to keep our residents in the city of Dallas safe. We recognize that our local health authority, Dallas County, which does a great job, has a bigger responsibility than the city of Dallas. 44-ish%, somewhere in the 40% range of all the coronavirus cases that they are contending with at Dallas County are not in the city of Dallas. So we have to be mindful of the fact that they have a big job at Dallas County and they're doing it well, but we have a responsibility as city leaders to take care of our residents and to make sure that we are doing what we can with the limited resources that we have. And we are trying to get more resources every day. We're asking the federal government every day for more assistance in all manner of ways, more absolute dollars to deal with coronavirus, but also more flexibility in the dollars they do give us. But we, with the limited resources that we have, are trying to make sure that we are doing everything we can to promote the things that Dr. Baggett has been talking about. We want to make sure we have the best testing and contact tracing regime in place locally that we can in the absence of a federal one. We don't have a federal testing regime and contact tracing regime. The state government has said they want to help with contact tracing. They've signed a contract recently with a company to help do contact tracing. We want to understand how that's going to work and how to make sure that in the city of Dallas we have robust contact tracing. So Dr. Baggett's job in my mind is to synthesize lots of information coming from lots of different sources and figure out how to make sure that the city of Dallas is well positioned to take care of its residents. And I'll let you speak to that as well, but that's the main thing. We have to take care of our own.
Absolutely. So it is a lot of collaboration and coordination, working across and surfacing things that might be helpful, bringing additional information and insights that actually also might be helpful. I've told so many people I'm here to serve as a resource and be helpful, and so they brought things to me to say, well, we're trying to address this. How might you help us to address that? Or we're actually reaching out to get this information. Could you help us with that? Or we're looking at some better ways that we could potentially approach that. Could you contribute to that conversation and action as well? So I really see myself as bringing forward ideas, information, thought, as well as some maybe expansion of networks in some areas so that we can better coordinate and utilize the resources that we have here.
And one more point I'd add to that I should have mentioned before, that's a major part of what I need Dr. Baggett to do for our city. That is, when it comes to data and knowing what data we need to be able to make good policy here at the city and make good decisions, the reality is we've been doing our best to use common sense and to inform ourselves with the knowledge that we have here at City Hall available to us as to what that data should look like. I'll be perfectly transparent with you and tell you the idea to require the reporting of testing data related to coronavirus came from the 1918 Spanish flu outbreak, and we borrowed that idea from Mayor Lawther, who was the mayor of Dallas back in 1918. He did something very similar. Well, we can't ask Mayor Lawther to help us with everything, so we need an expert, someone who has the knowledge of what data we actually need to make good decisions to actually consult with on a regular basis so we can make those decisions soundly. And so Dr. Baggett is also going to be helping us determine what data we need. So he's looked at things already and found some shortcomings in some of the data that we're currently collecting, and we're going to figure out how to get that data so that we can make good decisions.
One of the things I just want to make sure that we continue to state and reiterate, and the mayor spoke about this earlier in his remarks, is that you should exercise precaution in terms of where you go, where you can, and continue, even as we're sitting here, to wear masks, to actually take personal precautions and make sure you're safe. With this reopening, we want to make sure that even given the opportunity to do more, that you're doing it in a way that is safe for you and also considerate of others, so that we can minimize the harm and potential losses that are associated with this as well.
All right. Well, thank you all very much for coming, and let me know if you have any follow-up questions. Thanks.
Thank you, John.
Oh, always.
Doctor, thank you.
Dr. Baggett, good to meet you.
Yes, sir. Good to meet you as well.